Okay, so after all that cardio, diabetes should be a little bit of a break. Don't fail to take it seriously, but you have had more exposure to it. So first of all, in this section, we're just going to talk about the definition of diabetes. Um, in the next section, we'll talk about pathophysiology. So the definition of diabetes is the partial or complete deficiency of insulin and or tissue resistance to insulin. There are two major types, and then there are some other causes of diabetes that we'll touch on just a little bit. Type 1 is a complete deficiency of insulin. The beta cells of the pancreas are destroyed. No insulin is produced. That patient must have insulin to survive. The onset is most often under 20 years old. It can be a little bit past that, but it's most often under 20 years old. It's believed to be an autoimmune response. It often happens after a recent viral illness. It can also be idiopathic. I think that they're really the conclusion now is that it's almost always autoimmune. Patients who have family members with other autoimmune disorders are at greater risk for developing type 1 diabetes after a viral illness. Type 2 involves some combination of insulin deficiency, so they make some insulin but not enough, and insulin resistance. The tissues don't want to allow the insulin to bring sugar into the cells. Insulin production may be decreased. The tissues may be resistant to insulin, or both things can happen. The onset used to be most often after 45 years old, but it's becoming more common in adolescents and young adults, particularly they believe that our lifestyle is a factor in that. So there are contributing factors. A family history of type 2 diabetes increases the risk. Obesity increases the risk, and a sedentary lifestyle. But patients do not necessarily have to be obese to develop type 2 diabetes. Sometimes people will have lifestyle factors that put them at risk, but they don't put on weight because of a body type or because of the metabolism that they have. So don't assume that someone who's thin cannot have type 2 diabetes. There are also some other reasons that patients develop diabetes connected to either traumatic or illness-related damage to the pancreas. Patients with cystic fibrosis frequently develop diabetes later in life because cystic fibrosis affects the mucus that the pancreas secretes, and so it causes damage in the pancreas. And there's hereditary forms of pancreatitis that cause damage over time to the pancreas. So people can actually develop diabetes as a secondary disorder. We're primarily going to talk about type 1 and type 2, which are primary diabetes, but they can develop diabetes as a secondary disorder. The management is mostly the same, but if they have a secondary diabetes, it's not that the diabetes comes and goes, but their insulin production may be irregular. So sometimes they produce insulin, sometimes not as much. And so management can be a little bit trickier as far as maintaining normal blood glucose levels. Okay, we're going to talk about pathophysiology in the next section.